So you talk about the four pillars of fertility health. Let's go
Yes.
through them.
Yes, yes, of course. And you'll be saying, duh, no surprise here. So nutrition, right? We really need to eat healthfully so that we can get proper nutrients to all tissues, and whether they be, our blood vessels or our heart or our ovaries, because whatever is going into our body is going to be what is serving the rest of our body. Hydration, key. We are a chronically dehydrated set of creatures, and at best we're now trying to like throw some electrolytes into our limited water to see if we can maximize the benefits of that. But we really do need to be drinking more purified water, because regrettably, this is the environmental toxin thing, our tap water is not safe. It is riddled with bacteria, drugs, fluorides, all of these the other things that are all hormone interruption. They're going to either sit on our hormone receptor sites, or they're going to mimic hormone activity, which will affect our body's ability to communicate effectively from our brain down to whatever the end organ is that we're trying to communicate with. Um, Targeted circulation for the fertility person. I want, of course, good overall circulation, your walks in nature, get your exercise, but then there's particular targeted circulation to our ovaries and uterus, which can really be kind of the last in line, if you will, to get proper circulation. And those ovaries, if they are dehydrated or not getting proper blood flow, are limited in their ability to grow a healthy follicle and grow a healthy egg inside. So we have protocols in my Your Fertile Health program at Health University that really helps you in the comfort of your own home. And this is where I just get excited, because you don't have to run to more appointments. We are all running, we're too busy. And so if you could just do this 3 days a week in the comfort of your own home, it's the benefit of getting 3 times a week acupuncture targeted to your ovaries and uterus. And the results are there. The data is there for these particular protocols that shows in frozen embryo transfer settings. So we already know it's a demographic that has been having trouble, because she's ready for a frozen embryo transfer. For women over 35, again, a particular demographic, we know she's going to have a little bit of diminished ovarian reserve. The increased live birth rate for that population in a study of more than 3,000 is 42%.
Mm,
That's remarkable.
yeah.
And where I care is that it's not just that you had a baby, it's that you've had a healthier baby, because
Yeah.
again, blood flow to those ovaries and uterus to help give that baby a good start.
Yeah.
And
You
then
know,
that
oh,
was the fourth pillar, sleep, wake, you give yourself good sleep hygiene, because that's where we restore.
yeah.
Mhm.
I always say, and I was laughing with my husband last night, I said, if people aren't sleeping, nothing else matters. The nutrition, the supplements, whatever you're doing doesn't matter.
Yeah.
Going back to the circulation, that was something that we addressed with my daughter right off the bat through Chinese medicine,
Mhm.
Chinese herbals, to increase or unlock the qi
Yep.
down in their lower burner.
Mhm.
And then we
That's
also,
my language.
yep, we
Mhm.
also implemented acupuncture, and significantly helpful.
Absolutely.
So, in 1 year, her period pain went from a 12, literally was throwing up and had a hard time just even, she was in bed. She was in bed for months. It
Mhm.
was just awful.
So
To be able to go to school and go to practice and row, and maybe have to take a little Advil, but that was nothing compared to what we had. And so it was, those two things were huge. And then with supplementation and diet, it's not just about what you're eating, but it's also about what you're not eating. That
Mhm.
is something to remember. And I talk a lot about certain vegetables that could be the wrong healthy vegetables that could back up the liver, oxalates, and some other things. And everyone's different. You could handle certain things when I couldn't, vice versa, or you might be able to handle it at this stage in life. And if you are
Or even at
under,
this stage in a one menstrual cycle, Mhm.
yes,
Mhm.
exactly, exactly. So those things are all very important to take note of. And you're your best doctor. You know your system. You know when you have these symptoms, and possibly are they triggered by stress? Are they triggered by a food? But I would tell you women out there to journal,
Yes.
to make notes, to really try to connect the dots. And by taking a medication or a birth control pill, you're just masking the symptoms. You are not getting to the root of the problem. And that root of the problem is going to just stay there until you address it.
Right.
So,
And you very, very wisely said, this is not only just for your fertile years, because your fertile years are indicative of your perimenopausal years. And,
yes,
and really, it's happening at the same time, right? It's not just wait and then deal with the perimenopausal time. In that, age range of, 28 to 45, you've got one foot in the fertility side and you've got one foot in the pre-perimenopausal side, which can help you avert having and avoid having perimenopausal problems.
right,
We're seeing a lot of, influencers and actors and all of that talk about, if only they knew, and now they've got, their products and so forth that they're promoting, and that's great. But that is inferring that that is inevitable, and it doesn't have to be that way. You can avoid the problems that they're now trying to address by addressing your health